what's the difference? Does anybody know the difference without looking up here first? Sure.
Infectious are usually dangerous, and non-infectious, they don't spread easily.
Right, that's right. So infectious disease, as you can see, it's transmitted by a specific kind of contact. Usually it's caused by bacteria, a virus, parasites, or fungus. A non-infectious disease is typically what we call a medical condition. It's not transmittable. You can't give it to somebody just by touching them or sneezing on them. Usually it's caused by environment, lifestyle choices, nutritional deficits, or genetic causes. So non-infectious disease, these typically can be preventable by lifestyle choices. This kills more than 36 million people a year, and most of these are before the age of 60. The most common are cardiovascular disease, cancer, respiratory diseases, and also diabetes. All four of those things are typically caused by the bottom four things: tobacco use, physical inactivity, and a unhealthy diet, and also harmful use of alcohol. Does anybody have any questions? All right, and then next is there are some intermediate risk factors when you're talking about all those different kinds of medical conditions or non-infectious diseases. High blood pressure is one of those, high blood sugar, elevated blood lipids. Does anybody know what that is? Blood lipids just basically means fat in your blood. Also being overweight or obese. And I put a little picture on here. This shows fat in your artery, all right? So this is your normal artery right here. And all of this from here over is fat. That's not good. It's basically a cheeseburger you just ate yesterday from McDonald's. That's what's in there. It's pretty nasty. So that's why it's so important to have a good, healthy diet, because you don't want your arteries clogged up like this. Because when they clog up, then you have heart attacks, strokes, all sorts of bad stuff that you don't want to deal with. Kind of breaking it down into different categories. Environmental diseases, these are caused by external factors like sunlight, food, pollution, and lifestyle choices. Some of those diseases are COPD, chronic bronchitis. Does everybody know what COPD is? It's basically caused by smoking a lot of times. It's chronic obstructive pulmonary disease. You'll see a lot of these patients, if you see people wearing oxygen when they're at the store or out at the mall or something like that, those are typically those patients. Type 2 diabetes, lots of times that's caused by lack of exercise, bad diet. Malnutrition is another one. Skin cancer, girls don't be tanning, boys don't be tanning. Bad news when that happens. And also rickets. Does anybody know what rickets is? That is a bone disease when you have a deficiency in vitamin D, calcium, or phosphorus. All right, it makes your bones really soft and pliable. And this picture here, this shows this guy was a truck driver for many years. On this left side of his face, you can see that's where the sunlight always hit him on the driver's side. So you can see the difference that the sunlight made on him and the damage that the sun did to the skin. Heart disease is another one, major one. It's the #1 killer in the United States according to the World Health Organization. That includes heart attacks, stroke, again, high cholesterol or high blood lipids, fat in your blood, and high blood pressure. Other kind of body, different categories, diseases. There's bone disease, which is osteoporosis. That's basically where your bones become really fragile. It's very common in women, older women, especially Asian heritage. Paget's disease, that's another bone disease where your bones become very, very frail. Muscle and joint disease like rheumatoid arthritis. This picture here shows a severe case of rheumatoid arthritis. Typically, it's not quite as severe as that, but basically as the disease progresses, they basically lose function with their hands. A lot of times with their feet, they can't walk anymore because their toes do the same thing where they just kind of curl out and they can't move them back. Also gout. Does anybody know anybody famous with gout? Yeah?
Ted Cruz.
I don't know about that one. I was thinking some more science people like Sir Isaac Newton. Does everybody know who that is, or at least remember that name? Benjamin Franklin, he had gout. And then also mental disease falls under this as well. Autism, depression, narcolepsy, bulimia, anorexia, all of those things, bipolar disease, they all fall into that mental illness category as well. How do you prevent non-infectious diseases? Well, it's pretty simple. I'm sure you guys have all heard these things before. Live a healthy lifestyle, be a non-smoker, have a healthy diet, get plenty of activity, physical activity, and have regular checkups with your doctor, primary care physician. Those are the best things that you can do to help prevent the majority of those diseases that we went over. All right, so moving on to infectious diseases. These are the bad guys. These are the ones that you don't want to get. There are 5 different ways that you can get these as far as how they're transmitted from person to person. Droplet, direct physical contact, indirect physical contact, airborne, and fecal oral. Fecal oral is pretty nasty, but we'll go over that as well too. So droplet, a lot of times people will call it respiratory. It's caused when people cough or sneeze on you. So that's why you always want to sneeze into a tissue or into your arm, cough into your arm. You don't want to cough in your hand or be walking and sneeze on somebody. That's just pretty nasty because you're giving them all sorts of kinds of germs. Some of the diseases that are caused by droplet by sneezing or coughing, chicken pox, the flu, influenza. A lot of people, I'm sure, I don't know if you guys have all gotten your flu shot, but that's something a lot of people want to do. Strep throat is also caused by that as well. Direct physical contact is by touching the individual. Indirect physical contact is by touching the contaminated article. So everybody knows what athlete's foot is. It's a fungus that grows on your skin, pretty gross. So direct contact with athlete's foot is if you had a friend, they had athlete's foot, you took your foot and you rubbed feet together. Now you just had direct physical contact. Most likely you're going to get athlete's foot. Indirect physical contact would be if your friend has athlete's foot, has a pair of socks on, you say, oh, I forgot a pair of socks for gym, I need to borrow some socks from you. You take their socks, put them on. That's indirect because you're using the sock that most likely has that bacteria, that fungus on there, and putting it on your foot. Okay? Same thing with MRSA. A lot of times that's passed in schools as well, especially in locker rooms, or if you use towels, if you have siblings or something like that, a sibling that has something, looks like MRSA. Also STDs obviously are by direct contact. Some of those can be indirect as well. This is a picture of MRSA on the skin. It's pretty nasty. It almost looks like a pimple, but it's quite a bit bigger typically. Hurts a lot worse. There's lots of redness around that. So anytime if you think that you might have MRSA, and this is something that spreads quickly throughout, and from person to person as well. So if you ever think that you might have a little spot like that, have the school nurse check it out, or have mom and dad look at it just to see. So other transmissions, airborne, which is something, TB is tuberculosis. You don't hear about that too much anymore. They've pretty much gotten that under control. But it is something that typically it will hang in the air. So it's not something that if you sneeze, it falls to the ground. A lot of times what bacteria or different viruses will do, and then they disintegrate. But TB is something that can hang in the air. So if somebody sneezes, it stays in the air. And if you breathe it in, even if it's 10, 15 minutes later, you can breathe it in and get that. A lot of times in the hospital, they put patients on TB precautions or airborne precautions. It's where they put them in a negative pressure room. So like in this room, if there was a TB patient in here, they would suck the air out so that the air that they're breathing doesn't get out into the hallways or things like that. So it creates a negative pressure. The other thing is that there's a TB mask up here. It's a special mask. It's called an N95 mask. If you ever go to the hospital, visit grandma or a family member and see somebody with that mask on, it's probably because they're dealing with a TB patient. And that just helps the caregiver when they're in the hospital from getting that disease. The fecal oral people. A lot of times that's transmitted not necessarily from somebody wiping their butt and touching their mouth or anything like that. Yeah. Usually it's from somebody like at, let's say, a Taco Bell or something like that. They go to the bathroom, they don't wash their hands, and then they go back and they start preparing your food. That's typically how that gets, those things get transmitted. Two main ones, cholera and rotavirus. Did anybody hear about the cruise ships where everybody was getting sick and all that? That was rotavirus that a lot of them had. So, good thing to always wash your hands after you go to the bathroom. So, infectious disease, the best way to prevent this is by hand washing. Anytime you're around a sick person, try to avoid them if you can. If you know your friend has chickenpox or has the flu, don't go over to their house and hang out. Wait until they're better. If you don't feel good, don't come to school and pass that all around to everybody either. But if you have to, like I said, the number one best way to prevent any kind of infectious disease is by prevention, by hand washing. So, all right. Does anybody have any questions? That's pretty much all I have. Does all make sense?